And after this study, suppose after colposcopy we find stained and non-stained lesions, then we can go for the next level of test. That is how to diagnose. So we have punch biopsy, we have colposcopy direct biopsy, we have endocervical curating, and there are loop diathermy biopsies like LEAP and LLETZ, large loop excision of transformation zone, and loop excision of the epithelial cells, and cone biopsies. And these are other things, micro, which we usually doesn't use, micro colpohistoscopy. With histoscope also we can see the lesions where. Next. So there how we are diagnosed. Now what treatment we should give. So as you know, it is a local disease, and usually the good part of the cervix, it is the spreading of this disease is very late, and slowly it progresses. So it is usually a localized disease, and we can easily remove this complete pathology. So there are different tissue destructions, means we have to do different procedures, and the depth of destruction depends on the lesions. So we can go for electrocautery or diathermy or cryosurgery or laser surgery. Surgical removal like already large loop LEETZ, like large loop excision of transformation zone, and this also loop excision of the transformation zone. Conization means we keep a piece cone like structure, we keep the we cut the cervix, and lastly and not the least is the hysterectomy. I just want to cut short this with this algorithm of management of this these lesions. Suppose you are going for pap smear test. Now you find the ascus. The ascus is nothing. We can treat with first with initially with the antibiotic, and you can repeat the pap smear within again 3 to 6 months. Again, if the ascus has come positive, then you can go for this colposcopy guided biopsies. Suppose in the pap smear you get this low-grade squamous intraepithelial lesion or HPV infection in the HPV DNA testing, CIN1 or mild dysplasia, then also you can directly go for a colposcopy. High-grade squamous intraepithelial lesion, CIN1, 2 and 3, and moderate severe dysplasia, directly colposcopy guided biopsies. Suppose after ascus the repeat test is negative, then only you have to follow. So every yearly you can have a follow-up. Suppose the pap smear is negative, then we can go for these biopsies. The lesion are seen in the biopsies. So if it goes for low grade squamous intraepithelial lesion or high grade intrascopy, we can go for this cryotherapy treatment, LEAP, cryo, and laser. Suppose it is a micro-invasive carcinoma in this electrocauterizations, then we can go for a cone biopsy also. So this treatment of these things depends on the mostly the patients and the doctor choice, the age of the patient, the economic status of the patient, what the patient wants. If they are already above the age of 40-45 years and they have completed their children and all that, then you can go for this directly hysterectomy also. But if somebody wants to preserve the cervix because they want this for children and all that, then you can go for this loop excision and all those things. So as I told, there is no fixed protocol for treatment of the CIN. There are different methods, and it depends on the profile of the patient and the doctor's choice what to suggest for the best treatment in view of the best treatment for the patient. So all depends on age, parity, and extent of the lesion and type of CIN influence treatment modality, as I discussed before. So colposcopy is a must in abnormal smear, and cervical cancer is preventable, possible by, these are the things, by visual inspection of the cervix. So while doing a pap smear also, we go for a speculum examination where we can see is any growth or any abnormality in the cervix. So making use of cytology means pap smear test, and you can use the colposcope for diagnosis and biopsies also, and treating as early as possible. So these approaches will act as a prophylactic against the cervical carcinogenesis. So hopefully there were certain, for me, some network issues in the initial phase, but hopefully I have with short time and all that, I have cleared some of your doubts and given some knowledge regarding this HPV. Thank you.